Welcome back. This video is about Alzheimer's disease. Well, Alzheimer's disease is a progressive form of dementia, which is a broader term for conditions that negatively affect memory, thinking, and behavior. Now, dementia can have a range of causes, such as brain injuries or diseases. Sometimes the cause is unknown. According to the Alzheimer's Association, Alzheimer's disease accounts for 60 to 80% of dementia cases. Now, most people with the disease get a diagnosis after the age 65. If it is diagnosed before then it is generally referred to as younger onset or early onset Alzheimer's disease. There is no cure for Alzheimer's, but there are treatments that can slow the progression of the disease. Now, I will discuss some Alzheimer's facts. Although many people have heard of Alzheimer's disease, it is helpful to know the facts. Here are some key details about the condition. Alzheimer's disease is a chronic, that is long-term, ongoing condition. It is not a typical sign of aging. Alzheimer's and dementia aren't the same thing. Alzheimer's disease is a type of dementia. Now, its symptoms come on gradually and the effects on the brain are degenerative, meaning they cause slow decline. Anyone can get Alzheimer's disease, but certain people are at higher risk for it. These include people over age 65 and those with a family history of the condition. There is no single expected outcome for people with Alzheimer's disease. Some people live a long time with mild cognitive damage, while others experience a more rapid onset of symptoms and quicker disease progression. Well, there is no cure for Alzheimer's yet, but treatment can help slow the progression of the disease and may improve quality of life. Each person's journey with Alzheimer's is different. Now, I will discuss the symptoms of Alzheimer's disease. Everyone has episodes of forgetfulness from time to time, but people with Alzheimer's disease display certain ongoing behaviors and symptoms that worsen over time. These can include memory loss affecting daily activities, such as keeping appointments, trouble with familiar tasks, such as using a microwave, difficulties with problem solving, trouble with speech or writing, becoming disoriented about time or places, then decreased judgment, decreased personal hygiene, mood and personality changes, withdrawal from friends, family, and community. Now, these signs don't always mean that a person has Alzheimer's disease. It is important to see a doctor to determine the cause. Now, the symptoms change according to the stage of the disease. In later stages, people with Alzheimer's often have significant trouble with talking, moving, or responding to what's happening around them. Now, diagnosing Alzheimer's disease. The only definitive way to diagnose someone with Alzheimer's disease is to examine their brain tissue after death. But a doctor can use other examinations and tests to assess your mental abilities, diagnose dementia, and rule out other conditions. The doctor will likely start by taking a medical history. They may ask about your symptoms, family medical history, other current or past health conditions, current or past medications, diet, alcohol intake, and other lifestyle habits. From there, your doctor will likely request several tests to help determine if you have Alzheimer's disease. There is no definitive test for Alzheimer's disease. However, mental, physical, neurological, and imaging tests can help your doctor reach a diagnosis. Your doctor may start with a mental status test. This can help them assess your short-term memory, long-term memory, and orientation to place and time. For example, they may ask you what day it is, who the president is, to remember and recall a short list of words. Next, they will likely conduct a physical examination. For example, they may check your blood pressure, assess your heart rate, take your temperature, and request urine or blood test in some cases. Your doctor may also conduct a neurological examination to rule out other possible diagnoses, such as acute medical issues like infection or stroke. During this examination, they will check your reflexes, muscle tone, and speech. Now, your doctor may also order brain imaging studies. These studies, which will create a picture of your brain, can include Magnetic resonance imaging MRI scans. MRI can help pick up key markers such as inflammation, bleeding, or structural issues. Then computed tomography or CT scan. CT scans take X-ray images which can help your doctor look for the abnormal characteristics in your brain. Now, other tests your doctor may do include blood tests to check for the genes that may indicate you have a higher risk for the Alzheimer's disease. Now, I will discuss Alzheimer's medication. There is no known cure for the Alzheimer's disease. However, your doctor can recommend medications and other treatments to help ease your symptoms and delay the progression of the disease for as long as possible. Now, for early to moderate Alzheimer's, your doctor may prescribe medications such as donepezil or rivastigmine. These drugs can help maintain high levels of acetylcholine in your brain. This can help the nerve cells in your brain send and receive signals better. In turn, this may ease some symptoms of Alzheimer's disease. Well, a newer medication called aducanumab is recommended only for those with early Alzheimer's. It is thought to reduce the protein plaques that build up in the brain with Alzheimer's. However, there are some concern about whether the drug's potential benefits outweigh its risks. Well, to treat moderate to late stage Alzheimer's, your doctor may prescribe donepezil or memantine. Now, memantine can help block the effects of excess glutamate. Glutamate is a brain chemical that is released in higher amounts in Alzheimer's disease, and it damages the brain cells. Your doctor may also recommend antidepressants, anti-anxiety medication, or antipsychotics to help treat symptoms related to Alzheimer's. These symptoms vary based on the progression of the disease and can include depression, difficulty sleeping at night, agitation, or hallucinations. Now, other Alzheimer's treatment. In addition to medication, lifestyle changes can help you manage your condition. For example, your doctor might develop strategies to help you or your loved one. These include simplify tasks, limit confusion, get enough rest every day, use relaxation techniques, and create a calming environment. Now, some studies have suggested that vitamin E could help slow the loss of functioning in Alzheimer's disease, especially when taken with medications like donepezil that increase acetylcholine in the brain. But other research found no benefits when taking vitamin E for the Alzheimer's disease. Overall, more evidence is needed. So be sure to ask your doctor before taking vitamin E or any other supplements because it can interfere with some of the medications used to treat Alzheimer's disease. Now, dementia versus Alzheimer's. The term dementia and Alzheimer's are sometimes used interchangeably. However, these two conditions aren't the same. Alzheimer's is a type of dementia. Now, dementia is a broader term for conditions with symptoms relating to memory loss, such as forgetfulness and confusion. Dementia includes more specific conditions such as Alzheimer's disease, Parkinson's disease, traumatic brain injury, and others which can cause these symptoms. Now, I will discuss the causes and risk factors for the Alzheimer's disease. Experts have not determined a single cause of Alzheimer's disease, but they have identified certain risk factors, which include age. Most people who develop Alzheimer's disease are 65 years of age or older. Second is family history. If you have an immediate family member who has developed the condition, then you are more likely to get it. Then is genetics. Certain genes have been linked to Alzheimer's disease. Now, having one or more of these risk factors does not mean that you will develop Alzheimer's disease. It simply raises your risk level. Other possible risk factors include a history of depression, smoking, cardiovascular disease, or previous traumatic brain injury. Now, the prevention of Alzheimer's disease. Just as there is no known cure for the Alzheimer's, there are no foolproof preventive measures. For now, health promoting lifestyle habits are the best tools we have to prevent cognitive decline. So, following steps may help. Number 1, try to quit smoking. If you smoke, quitting benefits your health both immediately and in the long term. Then exercise regularly. Getting active reduces the risk of many conditions such as cardiovascular disease and diabetes. Then keep your brain active. Try some cognitive training exercises. Eat well. Eat a balanced diet with plenty of fruits and vegetables. Maintain an active social life. Friendships, volunteering, and hobbies are likely to benefit your overall health. But be sure to talk with your doctor before making any big changes in your lifestyle. I hope you liked my video. Thank you and subscribe to my channel.